My name is Andy Imparato, and I am the Executive Director of Disability Rights California. As you probably know, Disability Rights California is one of 57 federally funded protection and advocacy agencies for people with disabilities. We represent people with all types of disabilities across the age spectrum. And this pandemic has produced a number of challenges for the disability community in California and has really required us to be nimble and innovative as we think about how best to advocate for people in different ways, and people who are experiencing problems that are different than the traditional issues of access and discrimination that we address for the population in California. Overall, our advocacy over the past several months has really focused on protecting the health and safety of people with disabilities, trying to help them get access to the goods and services they need to survive the pandemic, and thinking about ways to frame reasonable accommodations in the context of a pandemic. One of the issues that I personally have been working on, and a number of my colleagues around the country have been working on, is the issue of crisis standards of care. These are standards that are put in place by hospitals if there's a surge and they have to start rationing things like ventilators. As you can imagine, this is a very important issue for people with disabilities, and there's a serious concern that the crisis standards of care have the potential to discriminate on the basis of disability status or age. And if you look at the standards that the state of California first issued, the Department of Public Health, they would have scored people lower in terms of their priority to get a ventilator and other scarce resources during a surge. They would have scored them lower if they were older, and they would have scored them lower if their quality of life after having the medical intervention was lower than somebody else's quality of life. Basically, if you were younger and healthier, you would be put at the front of the line. If you were older and sicker or disabled, you would be put at the back of the line. We feel that this is clearly discrimination, and I'm happy to say that with our advocacy, with our coalition partners, we were able to convince the state to modify their standards of care, and they removed the vast majority of the provisions that we felt were discriminatory. So we're grateful for that, but we're also sorry that we had to do that advocacy. And I think it points to kind of a systemic problem that the healthcare professions sometimes undervalue the quality of life of people living with disabilities. And that's something that we also are working on in terms of improving provider education as part of medical education. Another issue that we've been working on in recent weeks is trying to get hospitals to modify their policies against allowing visitors during the pandemic. There are a lot of folks with disabilities who need to bring somebody with them to the hospital in order for them to be safe in the hospital. They may need somebody to help communicate for them if they're difficult to understand. They may need somebody there to just help ease their anxiety and help them kind of navigate the hospital in a safe way. If they're blind, they may need help with navigation, in terms of just getting around to the hospital and getting around the hospital. If they're deaf, they may need somebody to interpret for them. And I'm pleased to say that the state has supported our request to get hospitals to recognize that bringing somebody with you, if you're a person with a disability, is a form of reasonable accommodation. We also, early on in the pandemic, when grocery stores started opening special hours for elderly shoppers, we advocated successfully with many of the chains to include shoppers with disabilities and their caregivers in those special hours as a way, especially for people who are immunocompromised, to avoid unnecessary exposure to risk during the pandemic. We also, another issue that came up early on in the pandemic was access to personal protective equipment for direct support workers. There are lots of folks with disabilities in California who are getting support in their homes, and it was difficult, especially early on in the pandemic, for the direct support workers who were coming into their homes to have the right equipment to both protect themselves from exposure to the virus and protect the people that they were serving. There are a number of folks with disabilities for whom the nature of the services they get, like help getting out of bed, help with toileting, dressing, things like that, it makes the physical distancing that's been recommended by public health officials just not possible. So in that context, it's particularly important for the direct support workers to get the PPE that they need to protect themselves and the folks that they're serving. We also have been doing advocacy around safety, and one of my colleagues is going to talk specifically about the issue of jails, but basically safety in nursing homes, safety in psychiatric hospitals, safety in any congregate setting where people with disabilities find themselves and where a lot of the spread of the virus has disproportionately taken place. And we've also noticed that the virus has disproportionately affected low-income communities and communities of color. And in our advocacy right now, we're trying to pivot from just focusing on the pandemic to also looking at the aftermath of the pandemic and the long-term economic harm that's been caused by the pandemic. We feel that the pandemic has revealed a lot of holes in our safety net that were there before the pandemic, but are worse now. And we will be advocating for a more robust safety net moving forward so that people with disabilities from low-income communities and communities of color especially, who've been disproportionately hardest hit by the pandemic, are able to address the long-term barriers to equal access to healthcare, access to affordable, safe housing, access to food. The access to housing especially is an issue in California, and one of my colleagues is about to speak more to that. But let me just close by saying that we're really grateful for our partnership with Morgan Lewis. We're grateful for your commitment to working with community partners to try to advance our mission and improve the quality of lives of children and adults with disabilities and their families. We're grateful to Lorraine Casto for serving on our board of directors. I'm grateful to Lorraine for being one of the people who hired me into this job. And now I'm going to turn it over to my colleagues who will talk in more detail about our work to protect access to housing, our work in the context of jails, and our work in the context of employment during this pandemic. I hope you have a great Community Impact Week. And again, thanks for this opportunity to participate.
Hi, my name is Zeenat Hassan. I'm a staff attorney in the Civil Rights Practice Group, and I'm going to talk to you about housing and homelessness. One of the biggest issues that our state faces is eviction. With unemployment at a record high, thousands of tenants are unable to pay their rent. Although the courts have adopted rules that halt the eviction process during the pandemic, those rules do not erase the obligation to pay rent. When the pandemic subsides and the courts reopen, California will face a tidal wave of eviction cases. DRC is advocating on the local, state, and federal level for rent relief and eviction prevention measures that will help tenants remain in their homes. You can help tenants too by joining us in our advocacy. We need your help to build capacity for an imminent housing crisis. Eviction prevention in this moment is crucial because California cannot afford more homelessness. For decades, our state has struggled to maintain its supply of safe, accessible, and affordable housing. This has led to higher and higher numbers of people being forced to live in tents, cars, and on the streets. Now more than ever, local government should be finding ways to house unsheltered individuals. Yet, many cities have continued law enforcement practices that criminalize homelessness and compromise our ability to fight COVID-19. For example, many cities have continued to enforce overnight parking bans and tow vehicles that people use as shelter. Other cities continue to perform sweeps of homeless encampments without providing alternative shelter for those who are displaced. DRC has challenged these sorts of practices by filing lawsuits in a number of places, including San Diego and Orange County. We are also engaged in administrative and informal advocacy across the state. Criminalizing homelessness, especially during the pandemic, is contrary to public health objectives. But more importantly, it is cruel and dehumanizing. We need your help to secure housing and services for our unsheltered neighbors so that California can finally end homelessness. For people with disabilities, housing is healthcare. Having a safe place to call home can be the difference between life and death. Housing is a human right. We want you to join us in the fight to make that a reality for everyone. We hope to work with you soon. Until then, we hope you are safe and well.
Hi, my name is Anne Hadreas, and I'm the Associate Managing Attorney of the Mental Health Practice Group at DRC in our Legal Advocacy Unit. And I'm coming to you from Oakland, California. I normally work in our Oakland office, although the virus has made us working remotely, so coming to you from my dining room. The Mental Health Practice Group works with individuals with mental health needs in a variety of settings. I'm going to discuss the work we're doing regarding people in congregate, primarily locked settings. With the coronavirus pandemic, we have seen just how dangerous it is for people in crowded settings like nursing homes, psychiatric facilities, and jails and prisons. Because of this, people with disabilities in these facilities are now at enormous and even fatal risk of harm. These congregate settings are especially dangerous because people are clustered in small areas, making social distancing impossible. And additionally, our clients disproportionately fall into groups who are more likely to experience serious effects if they contract the virus because of their medical conditions. So our work has concentrated on two avenues of advocacy for these clients. One is improving the conditions inside so transmission is less likely. And the second is encouraging people with disabilities to be discharged to less restrictive and less crowded settings where they're less likely to get the virus in the first place. So we've been working with the Department of State hospitals to encourage use of masks by staff and provision of masks to patients. We've also encouraged increasing access to cleaning products to allow residents to protect themselves. And we've been working with the department to encourage early discharge for patients where it can be done safely and where the risk of staying in the facility because of COVID outweighs any risk of their release. And another area where the mental health practice group advocates is in carceral facilities. We also investigate and litigate conditions in both adult jails and juvenile detention facilities. Our work is to ensure that people in detention do not suffer discrimination based on their disability, and that they get the mental health and medical treatment that they need while they're there. This work is guided by the reality that far too many people, particularly people of color and people with disabilities, are held in our jails and prisons. So in jails, we're fighting for better, safer conditions for our clients. And we fight for disability rights with an intersectional lens. So we're working to ensure that people in detention who identify as LGBTQ+ are getting clinically appropriate care and are not subjected to the horrors of solitary confinement conditions solely because of their status. DRC is working and fighting to protect people with disabilities in these dangerous places and going to court when necessary. Our urgency of this work is greater than ever. So please learn more about our work on behalf of people in congregate settings on our webpage, and we look forward to working with you.
My name is Connie Chu. I'm the managing attorney of the Pathways to Work Practice Group at Disability Rights California. I will be sharing with you the work that DRC has done in the area of employment in response to the COVID-19 pandemic. Even before COVID-19, the employment landscape for people with disabilities was quite bleak. According to the US Bureau of Labor Statistics, in 2019, only 19.3% of people with disabilities were employed, as compared to more than 66% of people without disabilities. And across all educational levels, the unemployment rates for people with disabilities were higher. People with disabilities have been disproportionately impacted by the COVID-19 crisis. Workers with disabilities are more likely to be employed in service occupations, production, and transportation, and less likely to be in managerial, professional, and related occupations. During the COVID-19 pandemic, this means that many people with disabilities are considered essential workers. In addition, as a result of the pandemic, many people with disabilities have additional or increased needs for services and supports. DRC has responded to these concerns in several ways. We developed a series of webinars addressing topics such as benefits available to people whose employment was impacted by COVID-19, services that people can access from agencies such as the Department of Rehabilitation or regional centers, and reasonable accommodations in the workplace. In addition, we have created template letters that people can use to request reasonable accommodations or paid leave during the pandemic, as well as a wallet card that explains people's basic rights to reasonable accommodations under the Americans with Disabilities Act. As California recovers from the economic crisis resulting from the COVID-19 pandemic, DRC will continue our focus on employment issues impacting people with disabilities. We urge California leaders to reshape the labor market with a new vision for equity and the inclusion of people with disabilities. Our state has the opportunity to be a national leader by ensuring that its most vulnerable populations have access to meaningful employment in the new California economy. For more information on this work, we encourage you to visit our website.